went to, Zambia, for the first time. And it's got about 13 million people, and it's got a huge challenge with both malaria and HIV. And so those have been two areas that the foundation's been very involved in, and fortunately with good progress in both areas. Health is delivered not just at government facilities, but also some partner facilities. The specific center I went to was connected to a Coptic church. They're in Lusaka, the capital city.
My name is Dr. Iman Labib. We are here at Coptic Church Hospital, where Coptic Hope Center for Infectious Disease is operating. Our center is interested mainly in HIV patients. It opened in April 2006.
The Coptic bishop came in, and it was a nice setting, and so we talked to patients coming in for their drug treatment, and I got a chance to meet with a woman who lived nearby and hear her story, how she'd found out she had AIDS and how the drugs had literally saved her life. Because of those drugs, her most recent child was born HIV negative, and that was a great joy to her. The goal with AIDS is to have a vaccine that will prevent anyone from getting the disease, but we're more than a decade away from having that. So the best tool we have right now, other than behavior change, is male circumcision. If males are circumcised, they get the disease 60% less than if they're not circumcised. And circumcision is an operation that takes about 30 minutes for a doctor, and you have to be pretty well trained, otherwise you can create infections or injury. Amazingly, even in circumcision there's room for innovation, and so Dr. Shang invented a plastic ring that you essentially put in, and it makes the surgery very quick, and it reduces the amount of infection. I asked the man who was just finishing, was it different than he had been led to expect? And he said no, he was still, enthused, would talk to his friends about it. So if we get the government behind it and we get donor money focused in this, it looks like we will in all these African countries that have big AIDS epidemics. We'll be able to get to 80% of the males. That's our goal by 2015, and it would make a huge difference. In malaria, about 5 years ago, the first big bednet project started. Zambia is the pilot country. Now bednet's been rolled out in many countries, but Zambia is where they've been there the longest. And it's a very well-run program. Malaria deaths and cases continue to go down a lot. And so it's really a leading-edge country, showing the value of the intervention. Well, it's a very timely trip because we've just done a strategy review of all the global health work the week before I went. And to see the importance of getting the word out about bed nets, getting the community involved in that, having the latest drugs to treat the disease, huge impact. So everything I saw really re-energized me for the huge investments we're making in these health areas.